So good afternoon or evening, depending on where you are. This is Yvonne DiVita with, excuse me, with BlogPaws Live on Google Hangout, and we have a very important guest today, someone who was at BlogPaws and did a session on healthy pets. So this is Dr. Karen Fling. She is the Partners for Healthy Pets spokesperson. And welcome, Dr. Fling. Can I call you Karen?
Of course you can. That's great. And it's great to be here. This is so much fun to be doing this. And I hope it's going to be a great experience for everyone.
I do too, and I think it will. And I think we have prepared fairly well for it. One of the things that's really important to Partners for Healthy Pets and to all of pet parents, but especially the BlogPaws team and the people that we work with, is that yearly vet visit. Or maybe even more often than yearly, because sometimes I think the older your pet gets, maybe they should go in twice a year. I used to take my cat that was almost 20 in twice a year.
Right.
So, go ahead.
Well, and you mentioned cats, and in fact, the American Association of Feline Practitioners now actually recommends that for cats over 7 that they definitely see their veterinarian at least twice a year. And, you know, when we look at industry statistics and a new study that came out recently, it's just amazing that nearly 20% of dogs and over 30% of cats are not seeing their veterinarian at least annually. And these are really alarming statistics, because what this means is that there are preventable diseases that are not being addressed effectively and that are not being treated for these pets.
I hear you. I hear you. And one of the questions that I had was talking about the types of diseases that you've been seeing in your practice, and you know, what do you attribute those diseases to, and what should we be aware of as pet parents?
Well, and we are seeing a rise in preventable diseases, and this is such a passion point to me, because as a veterinarian in practice, we see things that if we could have seen them earlier, we could have made a difference. And we, through preventative care, we're able to save lives, we're able to extend life expectancy, and we're able to save pet owners money. And I think sometimes people think by not going to see the veterinarian that they'll save money. And research shows that preventative care saves the pet owner anywhere from 2 to 9 times as much money and saves lives. So big passion point. And as you mentioned, there are things that we see that are preventable, things like obesity, things like dental disease, things like cancer and heartworm. And in fact, talk about cancer, frequently there are cancers that we see that if we detect them early, we can simply remove those tumors, and sometimes surgery is curative. It's not necessarily a ticket to chemotherapy or radiation or more involved treatments that a pet owner may not elect for, but found early, some of these cancers can be managed very simply.
Yeah, I wonder too, when we were talking about doing this this Hangout Live, I got to thinking about my days as a veterinary technician, and it was a very long time ago. We've had a lot of advancements, but one of the things that I'm still curious about, and I don't think I understand as well, is diabetes.
Right, and diabetes is definitely on the rise in pets because we see obesity is on the rise. And when we look at the average practitioner and what percentage of pets that they see are obese, the numbers are that greater than 50% of pets are in that obesity category, which then predisposes them to diabetes, which predisposes them to orthopedic problems, mobility issues, heart disease, and so there's a compounded effect of problems there. And with diabetes, what happens is that the pancreas is not functioning properly. There can either be a situation where you have an insulin resistance or a failure to produce enough insulin, and in those cases, even though the pet is eating, they're unable to utilize that blood sugar. And so goodness knows if we could control weight and avoid giving insulin injections multiple times in a day's time over a period of the rest of the pet's life, we'd much rather do that and just prevent it in the first place. So,
Yeah, so that, I mean, that really speaks to needing at least that annual visit. And I'm curious, I know that my pet bloggers are very much informed, and most of them, I would say, take their pets to the vet regularly. But the average pet parent doesn't always do that. So, you know, what reasoning is behind that? What do they tell you that they don't do that for? Why?
well, I think there are lots of reasons, and I think, you know, like you described the BlogPaws group of people, and I will tell you that I was so impressed by getting to meet that group of people in that audience. I mean, so I feel like I'm preaching to the choir to the BlogPaws group, because they are well educated, and I do believe that most of them visit their pet's doctor at least annually. But for the people who don't, the average pet owners that are out there that may not be as well informed or educated, I think there are multiple reasons. And one of the reasons is that I think sometimes people that are so intensely bonded with their pets and so connected with their pets, they really think that, gosh, they would know if their pet was sick, or when there are behaviors like reclusive behavior or not as much activity or less interaction with the pet, then I think some of those really bonded pet owners say, oh, well, my dog or cat is mad at me because I've been working too much, or I went on that trip and she's not forgiven me for that. And so there are a lot of human emotions where sometimes what are really medical behaviors are discounted, and the pet owner assumes that it's some other emotion that's causing that behavior. So that can happen where people put off going to see the veterinarian because they rationalize that it's not really a medical behavior. Also, life is busy. You know, between all of our saturation with texting and computers and our day jobs and the work we have to do, life is so super saturated and busy these days that people forget. And sometimes when you tell somebody, gosh, it's been 18 months or 2 years since your pet has been in, they just simply have lost track of time. And so that's one of the challenges we see. And then, of course, there's also Dr. Google. There's so much great information out there.
Dr. Google.
Pet owners will search the internet to try to diagnose their pet. And so we see pets that have suffered with preventable conditions that could have been managed, where somebody's been off on a tangent with a diagnosis they figured out on the internet. Really, maybe we have an abscess tooth or a broken tooth that's causing the pain or discomfort or the slowdown. The computer does not replace, certainly, a good, thorough physical examination with your pet's doctor.
So one of the things that I'm thinking as we're talking is, how can we pet bloggers convey this message and help people understand that, for instance, my little Boston Terrier a few months ago was sitting and acting fine, except for she would sit and she would lick her lips and lick her lips and lick her lips. And I said to Tom, I said, that doesn't seem normal to me. And we couldn't see anything that she would allow us, by the way, that she would allow us to see. And so we did. We said, we're taking her in. We took her in, and her teeth were bad.
Right.
So she ended up having a dental and some teeth removed. And it was astonishing how much better, not just not licking her lips anymore, but acting better. We hadn't even really noticed.
Right. Oh, that's such a perfect example. And we find statistically that in pets above age 3, that 75% of those pets actually have some form of dental disease, periodontal disease, some sort of oral health problem. So those statistics are pretty remarkable, that 75% of those over 3 have an issue. And with pets, I think instinctively they cover up when they're sick or when they're not feeling well, and it can be so hard to know that there really is a problem simmering like that. And you use the tooth example. There's an elderly dog that I take care of that is 17, and I saw her on an annual checkup, and the family came in and they said, well, she's starting to slow down, we can tell, and she does an odd thing where she seems kind of more whiny and needy lately, and in fact she's whiny when it comes time to go to bed. And so our routine now is we put her to bed in her little pallet beside our bed, and we sit on the edge of the bed and we rub her to sleep with our feet as we talk about what all has gone on in our days. And so, you know, more needy, you know, not as active, a lot of changes behaviorally. And so we do our examination on this poor dog, and we find out she has a fractured, what we call upper fourth premolar. And so this was a horribly painful tooth that difficult to see. It was one way in the back. And so I said, you know, we've got to address this painful tooth. And they said, well, even though she's old, because you say we have to address it, well, let's go ahead and address it. So we treated her infection. She wound up having to have a surgical extraction of the tooth. We removed that tooth, and within a week's time, this dog was sleeping well, sociable, not needy in terms of being whiny. The dog would go straight to bed when it was bedtime, slept beautifully. And then when I did my 2-week follow-up post-op, it was one of the most rewarding things in my life to see this dog, even though she's 17 and even though she has mobility compromise, she was bouncing around on her little stiff legs, and her whole affect, her whole facial expression, everything was different. And you know, we're 2 years down the road now, and she's still here today, and she's happy and lively, albeit stiff. But you know, I thank goodness that these people brought this dog in for her annual checkup, and I think that's the message. At least annually, we should be seeing these pets to prevent sometimes pain and suffering, and we need to remember that an annual checkup really is as essential as love and food, and that's the part of Healthy Pets message. It's so simple, but it's so important.
Yes, it's as important as food and love. And talking about food, we have a question from the audience that is relevant now. Let's transition into this. From Jim Burwell, it says, don't you also think that the quality of food that our pets get has a profound impact on diabetes and their health in general? Their food is becoming as processed as ours and full of sugars and dyes. And is that true?
That can be the case, and depending on the food that you choose, some of them do have dyes in them, and I think generally if you pick up a food that has lots of red and yellow and green, that's simply not natural, and there are some pets that don't tolerate those dyes and additives well. But nutrition really should be the first medicine, and your pet's doctor can help you make those decisions as to what foods are best. And you know, in terms of you know, sugars and fats and things like that, reading pet food labels is really something that we could probably do a whole nother discussion about. But I think pet food is such a big business these days. It is so hard to know by looking at a package what you need to be looking for to know what the best choices are. But again, your pet's doctor can help you make those decisions. And one of the best ways that I make those decisions with my pet parents is I look at laboratory tests and interpret those laboratory tests in combination with what diet choices we should feed. For example, with kidney disease, if we feed certain types of foods for kidney patients, we can double life expectancy. So again, food really is one of our first medicines. The other area where diet is so important is with obesity. And if we contain obesity, if we keep weight in check, then literally it's been found that you can add 2 years of life to your pet's life just by maintaining proper weight. And that doesn't even go into diabetes and issues and that sort of thing. So, I mean, I think if anybody told me that I could have 2 extra years with my dog or cat, you know, what a gift that is. And again, your pet's doctor can be the one to help you make those decisions as far as food choice goes.
Yeah, absolutely. So Carol's asking, though, related to food, is what's the most important ingredient in a quality dog food?
I don't think that there's any one certain ingredient that's important. You want to have the proper balance between carbohydrates, fats, you know, your proteins, all of those things. And again, it depends on how old your pet is. And for example, many pet foods are labeled as for all life stage foods. Well, those foods, if you read the fine print, have to, by FDA requirement, meet the growing requirements for a puppy or a kitten. And so if I have an adult or a senior dog or cat, probably a for all life stage food may not be the best choice for my pet. So there's a whole lot of nuance in terms of label reading that's really important to understand. And maybe we'll come back at another time and talk all about pet food labels.
I would love that if we could get you to do that. That would be fantastic. So moving right along here, because I think we're covering some of the questions that I had, but I don't want to let anything slide here, because when we're talking about the, it's so important. It's as important as love and food and anything else that you do for your pet. This yearly visit, which is what Partners for Healthy Pets is all about and what we should be about. That's on its surface, that's an easy message. But let me ask you this. I have a cat that doesn't like the cat carrier and hates the vet. What do I do?
Well, there are a lot of things you can do, and one of the most important things you can do is to seek out a cat-friendly veterinarian, because there are certain veterinarians that apply a special emphasis to cats, and even if you go to a mixed dog-cat practice, there are a lot of veterinarians that are very cat-friendly, and in fact, there's actually even a certification or a designation for a cat-friendly practice, so that's something you can Google and look up and find resources about. But there are things as a pet owner you can do to make sure that your visit goes the best way possible. And for me, I think it all starts with the carrier, because the carrier should be something that is a positive thing to your cat. Your cat doesn't be once a year pulled in from the garage with brown recluse spider webs hanging in it and corner. I think the carrier should be something that is out well in advance of the veterinary visit. It may be something that you choose to keep out all the time. If you put your kitty's food and water in a cat carrier, wow, the cat carrier will be this safe, wonderful haven, or a place to go get treats. And so cats will love a carrier if they have positive associations with it. Also the Feel Away company has come out with a neat little product that's a little Feel Away wipe. It's a little synthetic pheromone wipe that you can use in the carrier, so you can wipe your carrier down with that. So that helps to reduce stress hormones for the kitty cat and helps the cat to like the carrier better. So that's something helpful as well. Also, when you call your pet's doctor, you can talk to them about what is a good time of day to schedule my appointment for my cat. Is there a time when there's less commotion in the lobby? Is there a quieter time? Is that the first thing in the morning? Or is it midday right before surgery time? Are there certain times or days of the week where it's better for my cat to come in, where it'll be a quick visit, where it will be expedited? And then of course you want to make sure you have a good connection and a good sync with your doctor in terms of cat handling, because some people are more in tune to cats than others.
I agree. I actually worked at a cat-only practice.
We actually have both here. We have a mixed practice, which is dog, cat, ferret, pig, but then we have a cat practice. So it really does make a difference.
I love it. I love it. So we have another question that's kind of interesting to me. Chloe wants to know if pancreatitis is on the rise.
We see a lot of pancreatitis, and I don't know that anybody's done a recent study that actually quantifies what the numbers are of pancreatitis today versus 10 years ago. Of course, our diagnostic testing is much improved over the last probably 10 years. There's a bedside test, a little SNAP test that allows us to check in the clinic to have a more reliable indicator as to whether pancreatitis exists, where previously we just looked at amylase and lipase numbers, which are not as reliable in terms of diagnosing pancreatitis. But I personally think we do see more of that. And I've wondered if that relates to, as the earlier comment was, relative to the pet foods we feed in some cases, but it could also relate to a higher level of bonding between people and their pets. Because oftentimes, when people share their human food with the pets, things that are high in spices or high in fat, much more rich in calories and texture, some of those things can wind up being our culprits that cause our pets problems. But I believe that if we were to quantify and have that that retrospective study looking back, I believe we see more pancreatitis today, but that could also couple with obesity and dietary factors, and pet owners being more aware too when their pets are not well.
Absolutely, but I couldn't agree with you more about pet owners being a little too indulgent with their pets, and I'm guilty of that to a little bit, less than I used to be. The more informed I get, the more I talk to people like you, Karen, the more I understand that what I eat isn't proper for my pets. So what I am doing is looking at more natural foods, and I'm being careful about pet food labels, but there's still probably a lot I could learn, and the more I learn, the more I can share with the people who read my blog.
Absolutely. I agree with you.
as we talk about treats, there's so much going on in the marketplace with chicken jerky and
yes.
So sometimes even manufactured for dog or for cat treats may not be healthy for them. And if you have a sensitive tummied dog or cat, sometimes one of the most important things you can do treat-wise is to take a little piece of their kibble and give them that as a treat. And you know, cats sometimes are a little more finicky, but the dogs, a lot of times it's the whole act of getting that morsel from you versus just out of the bowl. It's a part of our social interaction.
That makes so much sense. I've never really heard it put that way. Very, very interesting.
Great question on the pancreatitis.
Yeah, well, her dog has pancreatitis, so she's dealing with it right now. And the poor little guy, she works with me. It's my daughter. She works here. She brings her dogs, and you know, we watch him a little more closely. He can't have the treats that the other dogs have, and I feel bad for the little guy. But in the end, to your point, we're the parent, and we have to make sure that we take good care of our animals and then take them to the vet on a regular basis.
At least annually. It really should be as essential as love and food.
I love that. I just love that, and it's so important. So we have one question that we haven't gone into this area yet, and I'm interested to see kind of what you say about it, because Carol's asking what pet parents can use for year-round safe flea and tick prevention.
Well, there are a lot of different choices that are out there, and while certainly flea and tick prevention is important, we also want to prevent intestinal parasites and heartworm. And so, again, I think your pet's doctor can help you determine which product is best to provide the broadest coverage for what your pet needs in the regional area where you live and exist. We see so much in the way of heartworm disease, and granted, we're based out of Texas, but when we look at the incidence maps that the Companion Animal Parasite Council is putting forward, it really does show that there's a progression across the country of these parasites.
Wow.
And heartworm disease is now found in all 50 states. And in our practice alone, we've seen a tripling in positive heartworm cases since 2000.
Wow.
And that to me is just a staggering statistic, because the medicine we use to treat heartworm disease in dogs is not even an FDA approved product currently, and there's only one company that makes that medication. And so right now, with the FDA pipeline being stopped up a bit with this product, as veterinarians, I wonder how long we'll be able to get that product. So to me, the answer is prevention is far better than treatment, and that's true whether we're talking about heartworm disease, fleas, ticks, intestinal parasites. And it's a matter of not only protecting our pets, but another passion point for me is that we protect our pets' families. And so that means you and me, our children, grandchildren, and extended families. We want to make sure that zoonotic parasites don't go from our pets to people either.
Wow.
And as we talk about cats, because cats are so important, there is no licensed or approved treatment for treating heartworms in cats. So again, prevention is our only option for these poor cats. So that's the best recommendation. And there are currently not over-the-counter heartworm preventatives, so my best advice is to use a product that's going to cover you for heartworm. It will cover you for fleas and or possibly ticks and other intestinal parasites. And there is a plethora of choices that you can make, and there are a lot of good choices, but make sure that you make the best decision with your pet's doctor.
Right.
whatever's best for your pet's health or for convenience for you, or what's most likely to have the spectrum of coverage that your pet really needs.
Yeah, I think sometimes that, as you said earlier, sometimes we go to Dr. Google, and that is certainly, I mean, we shouldn't be doing that other than to just find out maybe what to ask the doctor. But I really hope people will pay attention in this particular. Heartworm is so devastating, and I've heard so many stories. We need to get to the veterinarian and get the veterinarians.
Right, and in fact, because of emerging resistance trends with heartworm disease, there are some new recommendations that have just been released, and that may actually be recommended in many cases that actual heartworm testing be done twice a year versus once a year. Emerging resistance trends, and there's a strain called the Mississippi Delta heartworm strain, and then there's also the Mad Dog strain, and that sounds pretty good, obviously, for good reason, but these are different strains than what we've seen in the past, and the concern is that the actual treatment that we use for the heartworm disease, if they get infected, that is, if the dog gets infected, that the treatments may no longer work in some of these cases. And so that's really scary. And again, there's no over-the-counter product that's going to protect your dog from those things. And I think the average consumer, when they look at the shelf of over-the-counter products at the grocery store, at the superstore, at the pet store, those things look like a lot of things that the veterinarian may dispense, and sometimes there's even the message that it repels mosquitoes, but that is not the thing that it is protecting from heartworm. So
are mosquitoes the only way to get heartworm?
Yes, mosquitoes are what transmit heartworm from dog to dog, and even cat to cat or dog to cat. But again, with cats, there's also a preventative for them, and again, there's no treatment for the heartworm disease, just other than supportive care if they do get it.
Wow. Well, we only have 1 minute left, so let's kind of wrap up and tell us a little bit more about the Partners for Healthy Pet message and why it's so important. And also, if I don't have a veterinarian, how do I find a good one?
Well, you can find a good one through a variety of sources. There's the American Animal Hospital Association, or the American Veterinary Medical Association, that you can visit their sites with to hopefully find a great veterinarian in your area. You can also talk to local veterinary colleges or to veterinary medical associations on the local level. But I think when you look at bringing your pet to a doctor and establishing a relationship with a veterinarian, it's a great idea to view it as a pediatrician's visit and go interview those practices, get to know the doctors, get to know the office staff, and pick a fit that's just right for you. And remember that prevention is always better than treatment. It will save anywhere from 2 to 9 times as much money, and that annual checkup should be as essential as love and food. So very, very
Dr. Fling, thank you so much. I feel like we could go on for another half an hour, and maybe you will come back at some time. We'll talk about pet food labels. Yeah, we'll talk, maybe we'll get the community to say, okay, here are the things that we would really love Dr. Fling to talk to us about. And thank you so much, and thank Partners for Healthy Pets for all that they do.
It's been my pleasure, and it's an honor to be here to talk to such a well-educated, fun group.
Thank you.
Okay, thanks so much.